Finding ways to be joyful and to cultivate joy, because they're trying to tear us down. They're trying to take away all of our joy and make us feel hopeless. And therefore, feeling that hope is also an act of resistance in this moment.
Hi, welcome to the podcast.
Thank you for having me.
Yeah, so you're joining us from where?
Amsterdam.
Yeah, nice. How's the weather there?
Today was brutally cold, but it was sunny, so that was good. Yeah, the sunshine is quite rare here in winter months.
We don't get any sunshine here now. We've been cut off for the year, so.
Oh, I apologize. It was only a couple of hours, I swear.
Well, I am so grateful to have you today on the podcast. I'm so sorry that you couldn't join me in person, but this is our first time recording remotely because I'm just so excited to talk to you today about drugs and about your background, and just couldn't really say no to the opportunity to have this conversation with you. So welcome.
Oh, thank you. No, it's really great to be here and to be reconnecting with you, even though it's remotely.
I just really wanted to have a conversation with you about your background and how you started out working in the industry that you do, and then also talk about the work that you're currently doing, but also like where it's come from, where it's going. Why don't you just like give us a little bit of an introduction to like what your job is?
I do drugs and human rights. That's what some PR person once told me to say. And they would be like, then everyone would be like, oh, wow, what is that? But essentially, I work in drug policy advocacy. So I'm engaged as part of a global movement, efforts to advocate for a change in how drugs are controlled in our society. And this is based on the evidence that demonstrates that everything that governments have tried to do to reduce the scale of the drug market, to stop people from using drugs, to stop people from getting involved in the drug trade at any level, from growing drug crops or, transporting drugs across borders or producing drugs, more synthetic type drugs. Nothing they have done has worked. And everything that they have done has pushed the market probably in a more harmful direction and has violated, basic principles of human rights. So our work is very much grounded in the idea that we need to promote more just drug policies that uphold human rights and principles of social justice. That's kind of a broad overview. And my specific job is that I'm currently the executive director of the International Drug Policy Consortium, otherwise known as IDPC. We're a global network of NGOs, basically, who come together to advocate in a kind of global coalition for change.
Incredible. That's awesome. I have so many questions for you, but I guess the first one is, what is like your entry point into this kind of work? Like, I mean, we're going to talk a little bit about your childhood, but I mean, like, maybe you can start from like what got you interested in this in the first place.
Sure. Yeah. So many years ago, I was doing a master's degree in human rights. And at the same time, I had a job working at an international organization that was working on the HIV/AIDS response globally. And when I was there, I was, thinking about what to write for my master's thesis. And I really wanted to write on a topic that I felt was, really at the intersection of human rights and HIV. And I somehow, I got talking to one of the colleagues in the organization where I worked, and she was trying to increase within this organization that was responding to HIV more understanding about why people who inject drugs in particular were vulnerable to HIV. And I was like, well, why are they vulnerable to HIV? I didn't really understand. I was like, why do we give them clean needles? Shouldn't we just be trying to get them to stop using? And she explained, she was like my first, kind of harm reduction colleague. And she explained the basic ideas of harm reduction to me. And she was like, look, not everyone can just stop using drugs overnight. So in the meantime, we do need to provide clean needles and syringes to stop people getting HIV from sharing, injecting equipment. And I have to say, I know it sounds naive, but it kind of blew my mind, right? Because I had never really thought about it. And so I started talking to her a lot more and trying to understand what underlies the fact that people can't get clean needle and syringes and access to other harm reduction services. We're going back 20 years or so now. And basically, I arrived at laws and policies and the fact that people who use drugs are criminalized. And then, on further research, I discovered that there's a whole international drug control system that drives national level policymaking on how drugs are controlled in our society. And yeah, it kind of blew me away. So I wrote my thesis on, it was called Injecting Human Rights into Harm Reduction. But the idea was that I really started to look at what was driving human rights violations against people who use drugs, and looking at the laws and the policies and how they are the bedrock of those is actually an international drug control system that drives these policies, because governments are all adhered to laws at the global level that basically denote how they should control certain substances in society, drugs under international control. And that's how I got into it. And I was fascinated. And so I submitted an abstract to a conference, the International Harm Reduction Conference in 2008. And my abstract was accepted for a major session. I went there, I presented. And that feeling of like finding your tribe, like I just met all these incredible people who were doing such important work on the ground. And I felt like I found my community, people who were so brave and courageous and refusing to accept that, these laws in any way were just or were, improving the lives of anyone. And that's how I started. And then a job came up, the first job ever of this, to coordinate this network. And I applied for that job, and to my own surprise, got that job. And that was, like 17 years ago, almost to the day since I started.
Wow, 17 years.
Yeah.
Yeah.
Yeah, I wasn't the
That's
executive director. I was just the coordinator, but yeah.
right. Right. Amazing. I mean, like, you say that you feel like you were naive in that moment, being like hearing about harm reduction, but I'd say like there's a good majority of North Americans, or I guess like even globally, where harm reduction is just not like
Yeah.
in their vocabulary. It's still very stigmatized, obviously. We'll talk a little bit more about this later, because British Columbia specifically is sort of like a trailblazer in that sort of like, experimentation with harm reduction. It's had its ups and downs, obviously. But it's like interesting to me that you're presented with something that is a bit more taboo and also new to you in that moment, hearing about harm reduction and handling drugs in that way. And then you kind of like really dove in head first, which I don't think like a ton of people do. Would you say that's like a characteristic of your like personality? Like, do you you kind of like gravitate towards things that are a bit more like niche?
I think I mean, it definitely ignited my, it's probably going to sound cheesy, but like the sense of injustice I felt when I started to understand. And also maybe, it was kind of, in those days, it was kind of a niche issue for sure. I mean, I think it, like you said, it probably still is. It's just that I'm so embedded in it. I'm like, isn't it more mainstream now? And I feel like we've definitely been able to broaden out the circles of people who understand harm reduction. But I think you're right. I mean, we're still fighting for harm reduction to be accepted and understood. But yeah, I was enraged, I think, when I understood why what there was like this wall of prohibition that was driving so much harm for some of the most marginalized people in society. And I think for me, I felt like, if I could do something towards changing that or challenging that I would want to try. And I was always interested in working in an area of human rights, if that's, to say that firstly. And then when I hit on drug policy and human rights, there was just so much there that was still to be done, and still such a challenge, because it was, the conventional wisdom is that drugs are bad, right? And that we need to stop people using drugs by any means necessary, including locking them up, or, using the death penalty, or shooting people down in the street if we think they're involved in the drug trade, which still happens. I think that's what ignited me to get involved. And then with the networking, with kind of coordinating a network for this past 17 years, I really do believe that doing things together, right, is, how we get things done. And this sense of building a movement has been, just one of the greatest privileges of my life, really, to be involved in this kind of work.
I think it was Nelson Mandela that said that, was like, "If you wanna go somewhere fast, go alone. If you wanna go far, go together."
Yes, absolutely.
I love that quote. It's because 'cause I'm,
Yeah,
like, all about community, I'm the same. Because like, it's a piece of that, right? Like, you could study this until you're, like, blue in the face and, like, scream at the top of your lungs about a dissertation or anything that has to do with this, but if you don't have people helping, or people that kind of, like, are bringing in different perspectives, or kind of being boots on the ground, it's really kind of, doesn't really have legs. So, that's
yeah.
very cool. I obviously very much identify with what you're saying. Working in my industry of women's advocacy, I understand personally, like, my background of being, like, a woman of color, living in communities generally when I was younger that were mostly white, understanding, like, what it felt like to be marginalized. Did you ever have, like, do you feel like anything from your childhood really informed this kind of, like, thought process for you, or this sort of gravitation towards human rights?
I think so. I grew up in Thailand. I was born in Thailand. My mom is Thai Chinese, so she's also, I guess, she's an immigrant, because we are not Thai. We're ethnically Chinese, and her father actually came from mainland China. Her mother, my grandmother, was actually born in Thailand, but to parents who had come from mainland China. And my father was English, 21 years older than my mother, also. There's a lot of unusual things about my childhood. And also, there was a lot of, I mean, Thailand has changed a lot in the last 48 years. That's how old I am. I've been, I think it's important for women to be proud of our age. Um,
100%.
yeah, so 48 years ago, and in 48 years, Thailand's changed a lot. It's become like an upper middle income country. Of course, there's still massive inequality, but I think that the middle, what we refer to as the middle class, has definitely expanded. But the Thailand of my youth definitely was more unequal. There was a lot of inequity, and I saw it all around me. And although we were not, extremely wealthy in any way, my parents both worked really hard. They both had full-time jobs, and invested a lot in my education. But I understood how privileged I was compared to so many other children, the children in my neighborhood that I played with. And I think there was a sense in me of, like, this just doesn't, there's something that doesn't sit right about this. I also was always aware of being in Thailand. There were conflict situations all around us as well, which kind of fascinated me, but also terrified me. Of course, there was the Khmer Rouge and the genocide in Cambodia that was happening not so far away from where we were. My father talked about these things, and I think that kind of instilled that sense in me. And also Burma, what is now called Myanmar, and what was happening there in terms of the military dictatorship. My father had employed people at his office. He ran an advertising agency who were Burmese. So I was very acutely aware of these injustices happening around us, and I think, maybe that kind of interested me in this sense of, like, the world is kind of bad in many ways, but I guess it was my dad who instilled a sense of like, there are things that we can do about it, and we can stand up for what we think is wrong. I don't know. I've never been asked this question, Amanda, and I really appreciate you asking me it because I don't know where it came from. I don't know where it comes from, but I definitely feel like, my father instilled this sense of like, if you think that something is wrong, then you should say something about it and you should stand up for other people also when something is wrong. And yeah, I think that's what it was about, I guess. Yeah.
Well, I always get such a jolt of like serotonin when someone tells me that it's a question they've never been asked before. I'm like, I'm doing it, journalism. Um
Yeah, you are. Yeah. And I'm quite emotional sharing it with you because I haven't
oh,
really thought about it
it's true though.
in
I
that
mean, like these
way.
kind of yeah, these experiences really shape who we are. The older we get, the further we get away from our
Yeah.
childhood, the more we don't really think about it. But yeah, it's kind of similar to me. Like, well, my family were immigrants living in the South of the US. And I mean, we didn't talk about like racism like openly, but like we did talk about like, I don't know, my parents were just always very kind to people that were like less fortunate than us. And that was always really apparent to me. And Honestly, like, I was probably really informed by the Spice Girls, to be honest, when I was thinking about this the other day, because someone asked me the same question, like, "Why do you work in, women's advocacy?" And I'm like, I mean, I don't wanna dumb it down too much, but maybe, like, the Spice Girls?
I love that.
Um, I don't know, it just, like, felt like eye candy to me. I couldn't, like I was just like, "Wow, like, a girl group, cool." But it does sound like your father had, like, huge influence on, like, the work that you do, or maybe your gravitation towards the work that you do. Can you think of anybody else or anything else that maybe inspired you as a kid? It doesn't have to do necessarily with what your work is, but just, like, in general, influences on your life.
Yeah, I mean, I can also talk a bit about where we met, for the first time because being completely honest with you, that was a huge turning point for me personally going
Yeah,
to
me too.
yeah,
Tell
it was
everybody where we
huge.
met 'cause the audience doesn't know, so
Okay, yeah. So Amanda and I met in June 2023 at a retreat for women in Palm Springs called Loaded Bow. And I almost didn't come to that retreat because I was having a nervous breakdown and I was not in a good place. I had just moved from London to Amsterdam and I was thinking, how can I go to this place with all these people I didn't know? I knew one person, my friend, who had invited me there, our friend Megan. And I was like, why am I flying to the other side of the planet, to the middle of the desert, to go be with these women when I'm feeling like I can't stop crying and I just don't know, I was really having a kind of crisis. And Megan was like, if you're having a nervous breakdown, this is where you need to be. So I got on that plane. I really can't explain to you in what bad shape my mental health was in. And I got there. I was really nervous. I was, scared. I had been asked to give a fireside talk, which I wasn't sure what I was going to talk about. I didn't want to talk about my work at that time because I was very burnt out from my role. And so I decided to talk about this question of belonging, like where do we belong? I am mixed race, and there are lots of challenges that come with that. Although, again, going back to my parents and my father in particular, he had always encouraged me to be really proud of being mixed and to see it as a massive privilege, which of course it is. But I think until my 40s, I never allowed myself to understand the pain that came with also being mixed because there's a part of you that understands that you never fit in anywhere, right? Like, I don't look like my Chinese family and I love them dearly, but and they love me, but it's clear that, I'm not ever going to just easily be one of them. And in the UK and in England, there's also this other weird side where people erase my Asianness and they don't see that I'm mixed and they just, it's easier for them to just identify me as white. And so that erasure also causes pain in me and how I identify with myself. And going to Loaded Bow and being so scared and nervous and not in a good place and giving that talk and receiving honestly so much love and acceptance and being seen in return, just like, I don't know, it filled my cup in a way that I cannot describe. And also just generally being there amongst all these incredible women and realizing that I thought so many of them were so amazing, but that they thought the same of me, and feeling that acceptance was just such a transformational moment for me. I can't tell you enough what it's meant to me, really. It's like a real marker in my life.
I mean, like, I feel the same, and, like, I also
Wow.
almost didn't go, and, I was worried that it was just gonna be a bunch of, like, white ladies in the middle of the desert, like, talking about, like, white feminism, and I was like, "I'm not really interested in this." Um, but, I had some people really push me to go, and I also didn't really know what I was gonna talk about. I don't know if you were around for my talk.
I
Um
loved your talk.
But I talked about, like, you know, how to learn to be bad at things, obviously, very on brand for me. And the acceptance and the belonging piece, yeah, I mean, like, you talked about it, but also that's like an inception because that's, like, probably how you felt in that moment, and you not being able to really describe the feeling is exactly how I feel every time I get to build these rooms of, like, just women learning and being in a room together learning, and that's all they're there to do. It's magical.
Yeah.
Yeah.
Yeah, I loved your talk. I remembered it so clearly. I'll be honest, I was a little intimidated by you. So I was like, my God, she's so cool. I don't know, like, if we're ever going to be friends because she's like way too cool for me and she's so badass.
Oh, come on, Anne. You live in Amsterdam and you work in drug policy? Get over it. Why? You're so much cooler than me. This is gonna be the whole episode is just us talking about how cool each other are. Start blushing.
Yeah.
Okay. Well, I mean, like, I think that's a great answer, about who was, like, influential towards you or people that have inspired you, like, everyday like, women, just, like, women in general, like, that you've never
Yeah.
met before. I'm never not surprised when I talk to a woman that I've never talked to before and just hear her story and hear her perspectives and, understand, like, the quirkiness of her background or, like, the way that she is or her personality, like, it just astounds me. Just love women so much. It's really one
Yes.
of the biggest joys in my life, so I totally
Yeah.
relate to that. Speaking of learning, like, what kind of learner would you say that you are?
It's something I think I've discovered about myself more recently is that, and again, this is like that hilarious meme of like how ADHD is a marketing scheme because like you diagnose yourself and then you diagnose five friends. But but genuinely, I realize that I do have a mild form of ADHD. I struggle to concentrate on things for long periods. I'm a learner who I think I learn best with others and talking and sharing and in groups and because I'm also an extrovert. So for me, it's that I think I learn best when we're learning together. I'm not someone who is very good, like in a room by myself, trying to learn, trying to cram. Yeah, I'm not a solo learner. I think I need the distraction of others, and I need to bounce ideas off others and get excited with other people. I don't know what kind of learning style that is, but that's generally me. I was probably quite disruptive in the classroom, like a bit of a class clown, if I'm honest, like making
Oh,
jokes.
yeah.
I love making people laugh. It's like my favorite thing to do,
Oh my god,
especially when they're
same.
not expecting it. Right.
Yeah, I know.
Yeah.
It's like that's like a drug, honestly. It's
Yeah.
like
Yeah.
it is like making people laugh. Like I totally understand stand-up comedians and why it's so addictive to them.
Yeah.
Um, it's the
Yeah.
best.
It's totally
Um,
the best. So, yeah, and you're reminding me that my ADHD for sure was maybe because I do now think back to some of my school reports where, it was always like, Anne needs to pay more attention in class, and my parents would despair and I'd be like, whatever, I told some great jokes.
I saw a meme recently that was something like, although girls that got in trouble for talking in school or like running the workplace then or something like that. Like, although I guess according to like a recent, although at the time of this recording, recent New York Times article, we were ruining the workplace apparently. So, did
Oh
you see that
dear.
article? My
No,
goodness.
I'd love to though. Please share
Just
it.
infuriating. Yeah, I mean, like in my experience of working with that academy, you're not alone in that feeling. Like literally learning better in groups. Like my experience, obviously, I don't want to speak for everybody, is that a lot of women learn so much better when they're in a group. So a lot of group fitness classes, a lot of women like to learn with other women next to them. And personally, I think it's because we are such magical, amazing beings that we can act like we can get information that isn't just verbal or visual. It's like I'm not really sure how to say it, but almost like an like we get emotional information, like micro expressions, body language, the feeling of the environment. I think the information we can receive information in ways that I think that, in my opinion, a lot of men aren't able to. And it really helps us fully get like a big picture of like what we're talking about when it comes to whatever subject we're learning. So I don't think you're alone in that. And
Mm.
a lot of women in my network have ADHD. I like to say that that academy is like a school for the modern ADHD woman because we have so many different subjects that we teach on. So
Yeah, absolutely. Also ADHD is, I think there's lots of positive things about it, right? Like, the way that you can process information, you can kind of keep track of many different things at once.
or you
I also
try
I you
you
try.
try anyway.
I mean,
You try.
the problem is you burn out because that's what you're trying to do if you don't realize that you're doing it. And I definitely think that was also a bit how I came to that retreat, right?
Right.
I'd hit a wall with all of the balls that I was constantly juggling. But yeah, I love what you just shared about how women learn together in this, like, and it's somatic almost, right? It's so much more than the words that are being spoken. It's how we sit together in community, how we are tactile with one another, how we take care of each other, how women listen to each other. I think there's such a difference in, at least in my work, working with women and just how women create more space for each other, I find, than perhaps men naturally do. So I do definitely see that. Yeah.
Yeah, it's such an important piece to the work that I do is creating these spaces that just for maybe a moment, just a couple hours, we're able to not live under patriarchy. We are just in this room and it's just us. And you can see
Yeah.
everybody just melt a little
Right.
bit.
Yeah.
It's magic. It
Yeah.
feels like you could just be yourself. I feel like everybody kind of reverts back a little bit to like what they were like when they were a little girl. And they're just like wild and they don't care about anything and they can just play. I just love seeing women be free and expressive of themselves. And then for other women to just be like, oh, I can accept her and then I can accept myself, and that's
Oh,
kind of
gonna make me
and that's
cry.
yeah. And that's like I mean, that's where we're gonna really see I think real change and how we can actually push the feminist movement forward is making sure that that happens within all of us first,
Mhm.
individually. So everybody's on their own journey, obviously, but it's so important that we're supportive of each other when we do come out to learn and play together. So
Yeah. Yeah, I
yeah,
love that.
I guess this brings me to my next question. How does like feminism interact or kind of like I don't know, like, intersect with drug policy reform? Because it's something that I know it's a huge question, a big left turn into, like, what we were talking about, but I guess, like, how is gender sort of spoken about in the conversation surrounding drug reform? Like, I have a lot of questions about this because I don't think that it's something that is often spoken about publicly.
Yeah, I'm so glad you asked this question, and there's so many different things I want to say. It is really important, and there's a huge intersect. And in fact, exactly 1 year ago, in early December, there's an international feminist network called AWID, and AWID have a conference every 5 years of feminists coming together, and they were having a conference in Bangkok last December. And within our movement, a group of organizations, and it was all women within these organizations, just kind of, yeah, I'm not sure, because many of organizations in drug policy, interestingly enough, are led by women. And when I first started, they were mostly led by men. So there's been a huge shift. But that's probably part of the reason why there's this group of women. And we went together to this feminist conference. And because we were all women in the lead up to this conference, when we were organizing and preparing to go to the conference together, the way that we connected and discussed and decided how to show up at the conference, I think, was different, going to your point about how women talk and relate to each other and create spaces for one another. And so we went to the conference and we decided not to go without organizational logos, but to go under a kind of agreed umbrella and branding around, like, and I think the slogan was basically, yeah, it's here on the back of my phone. I don't know if you can see this, but it says, "There is no feminist future without ending the war on drugs." And that was, one of the basic slogans under which we went together as a group of women working in drug policy and harm reduction to this international feminist conference. And I think that the way that we showed up together and supported each other at the conference and made a splash, in a way, like got our issue on the table with the feminists, was really cool. And I feel like a big part of that was because we collaborated, because we were all women. So that kind of, to your earlier point about women coming together, I really love that, because like in any movement and field, there's always a lot of rivalry and we jostle around and challenges around funding and stuff. But in this moment, it was really a beautiful moment of coming together and being together.
That's really powerful because, like, it's like you were, calling out the thing that made you a minority in that moment in order to make a point to push something forward, and, like, it obviously made a huge impact. It's amazing.
Yeah, definitely. I've had some feedback from AWID, and they said, like in the survey after the conference, many conference attendees mentioned the drug policy and harm reduction messaging that they saw there. They were aware of our presence at the conference, and we were like, 25 of us or whatever. So that was really cool. But the intersections are huge because, in terms of punitive drug policies, and this will come as no surprise to you, Amanda, but of course, women bear like the brunt, right, often, of drug policies. If you
Yeah.
look at incarceration, for example, women are disproportionately incarcerated at higher rates than men for drug offenses, for what we call, low-level drug offenses. And there are more men in prison. Just to be clear about that. But in terms of when you look at women in prison, there are higher numbers of women in prison proportionally than men who are there because of something relating to drugs. So to give you a very concrete example, and it's interesting that we were in Thailand for AWID last year, but Thailand is one of the worst offenders. So around like 90% of women incarcerated in Thailand, even today, are there for really low level drug offenses. So they're like, for being caught with tiny quantities of drugs. 90% of the women in prison in Thailand are there for drugs. And most of them, they're not the kingpins, right? They're not running the organized criminal networks that are trafficking drugs across borders. They're usually like the couriers, or they might have been working in a factory producing, and they're getting paid like, I don't know, a couple of dollars a day, or they might have been given, I don't know, a couple of $100 to take a small amount across the border, and they're caught and they get inordinate sentences, 10, 15, 20 plus years in prison. So actually, we've had a large project that has been looking at the over incarceration of women for drug offenses around the world, because it's not just a problem in Thailand or in Southeast Asia; it's also in Latin America. And the reason for that is because women are more often in situations of economic vulnerability, right? Which is why they might engage in the drug trade in the first place, because they're desperate, because they need to feed their families, because there are not many other options for them. And so that's the direct link. It's around their marginalization, which increases their vulnerability to getting involved, and then their vulnerability to getting caught up in the criminal legal system. It's very clear. And then so that's just in one way that women are affected. There are so many others. We can talk about how trans women are treated. We can also talk about how women who use drugs are also really, when we talk about harm reduction services, obviously in many places, there are not services tailored for women. They're all geared towards men in general, and women don't, many women are worried about being seen at the harm reduction service. They, this whole idea that women, we're mothers, our bodies are holy in some way, this kind of moralistic idea about who women are in society means that women who use drugs are often seen as, bad women, the most flawed women, and are undeserving of services and undeserving of rights. And I think that's still in many societies, women who use drugs who are, particularly poor and marginalized are in, really desperate situations, the way that they are treated.
I can't say I'm surprised.
Yeah, I'm sure you're not. Yeah. So there's a huge intersection between taking like a feminist and gendered understanding of the harms of the war on drugs and the disproportionate impact on women. And then maybe if I just say a little more around the feminist approach, because I'm actually very interested and currently working on a project which is not yet funded, but I hope it will be, to kind of develop like a feminist manifesto when it comes to drug policy. Like, what are drug policy principles grounded in feminism? Because when you take this feminist lens to it, it's not only just about women, right? It's about the structural kind of violence that, women, people of color, Indigenous people, gender non-conforming people who are marginalized and vulnerable in some other way, disabled, how the war on drugs impacts on them too. And I think it's really interesting to take this approach and to kind of, discuss drug policy from the feminist perspective in the broadest possible sense.
Yeah, like, I think inherently, like, I mean, you can't really talk about it's just interesting to me because there's a huge disconnect between, I think, like, you would never talk in the same, like, string of words, like, about drug policy reform and then also feminism. I think a lot of people just don't have that sort of, like, mixing, like, gender isn't usually part of the conversation. I mean, it's not feminism if you're not just talking about, like, women's rights specifically. I mean, like, intersectional feminism, which was, I guess, the terminology that we used maybe, like, roughly, like, 5 or 6 years ago, has sort of melted away because we all realize, like, it's not intersectional feminism is just intersectional feminism. Like, you can't just,
Right, exactly.
we're we're not like TERFs, like, no one's here, like, trying to, like, marginalize more people through feminism. It's, like, literally the opposite of what that is. So I guess, like, through this work that you're trying to get funded, is it that you're trying to help people understand why drug reform is, like, so important, through the lens of feminism because it has such a huge effect on, like, so many marginalized groups of people? Like, is it a different way of looking at it? Because, like, I think the lens that people look at drug reform at right now is like, "Oh, we have all these people that are addicted to drugs, and we have all these drug runners and drug lords, and we're trying to, like, stop all of it," without understanding the actual people involved, like the players of it, which is that a lot of these people are just really, really vulnerable to this type of lifestyle.
Yeah. Yeah, I think exactly as you've said, I think it's so important to humanize, right, the conversation, because we're just like, drugs are bad. People need to stop using drugs. Anyone involved in the drug market needs to be like punished in some way. But who's involved in the drug market? Who are we talking about? These are people too. Who are these people, right? I mean, it's really about, and drug people who use drugs have borne the brunt of this also, because they have been so dehumanized, stigmatized. Their humanity has been taken away from them. Really, it's like there's, they're disposable in society often, and they're bad people. They shouldn't, it's a moral failing, and it's about readdressing that. And also, I think the feminists, I mean, it didn't start with taking a feminist lens, but I think taking the feminist lens really shines a light on that. It's like, what are the other interests that this war on drugs has served? And for example, I mean, the racism that is embedded in punitive prohibition, I mean, has, it's astounding. It's not by accident, it is by design, right? Like, who are in our prisons? I mean, in the United States, for example, the rate of incarceration of, like, young Black and Hispanic men compared to whites for drug offenses is so disparate. But people who are white and people who are Black and people who are Hispanic and people who are Asian probably use drugs at not that, differentiated rates. But the burden is on people of color, for sure. The burden of policing and incarceration. And so I think that's something that, we have started to shine a light on, but there's still so much work to do that. Like, who do these power structures serve? And what is the structural violence that people face from something like punitive drug policies? And and then also understanding, like, the vulnerabilities that people have, which, increases their engagement in the drug trade.
It's I mean, like, okay, so I just want to preface that at the time of this recording, there's quite a bit of like geopolitical unrest with the United States carrying out a lot of very like seemingly random strikes against just like small vessels on the coast of Venezuela in the name of drug control. And it's really strange to be watching this happen because it's so blatant, like blatantly awful.
Yeah.
And I think like from a bit of my research, that the Human Rights Council kind of came together to sort of have a discussion about this. Was it in Geneva? I'm not
Yeah.
really sure.
Yeah. Yeah. Well, there was there several human rights bodies of the UN have made statements about these. They are extrajudicial killings. That's what's happening, and now today, I think last count, 87 people have been killed through
Yeah.
these strikes. And it's like a summary execution, right? I mean, Trump is acting like, judge, jury, and executioner. There is no necessary evidence that there are drugs on these boats, but, the US government has decided unilaterally just to bomb these fishing boats and say, well, it's in the name of stopping the flow of drugs into the United States. I mean, on so many levels. I mean, the violation of international law is obviously, extremely problematic, to say the least. And I hope that other governments, as well as the UN, I mean, the UN human rights bodies, the High Commissioner for Human Rights has made a statement to say that this is unacceptable. And, the US must stop doing this and must account for their actions. The UK has now said they will not share, intelligence anymore with the US because they do not support these airstrikes in the Caribbean. And I hope other countries will follow suit.
I mean, I think
And
Colombia too. I mean, Colombia's pretty upset about it as well, which is wild to me because I was doing some research and they're not, has always historically been quite close with the US, and now this move is really like out of nowhere. I don't know.
yeah,
Colombia's pretty upset as well.
yes, many of the Latin American governments are upset. And, like I was saying earlier, like, what is the real reason for these strikes, right? I don't think it's related to Trump trying to stop the flow of drugs into the US, because are drugs really coming into the US on small fishing boats from Venezuela? I don't think that's the main trafficking route. And certainly also the drugs that the US should be concerned about are related to fentanyl. I mean, fentanyl is not coming from other countries in Latin America. Maybe it's coming from Mexico, but still, anyway, it's questionable. Obviously, it has something to do with him trying to unseat Maduro. And, there's another like geopolitical reason, as there always has been, right? I mean, the US has always used, first, the war on drugs, also the war on terror, to justify military action in third countries to serve their own interests. That's what this is about.
Right. I mean, like, this kind of brings me to a very, I don't know, it's kind of a language question, which I don't even know if you're able to answer because you're not a linguist, but I just like the terminology of like war on drugs, war on terror. I mean,
Yeah,
like, I should have looked this up before we started this interview, but that I forget the person that coined the phrase war on drugs. It was it was
Richard
a C
Nixon.
that it was
Richard
Nixon. That's right.
America's public enemy number one in the United States is drug abuse.
Are other international bodies like trying to stop use like they just like why does everyone use this terminology? Because it just seems so like hyperbolic and flies in the face of like what you're trying to accomplish, which is like, actual drug reform.
I think we have had a whole, like, we've gone full circle in our movement around this, Amanda, because, initially then some people were like, we need to stop saying war on drugs ourselves. So then, then we moved to the so-called war on drugs, and we would always put it in quotation marks. But in the end, I think what's happened now is that we still, whenever I'm talking to you, and if I was writing it, I would probably put it in quotation marks. But I think we got to a point where we're like, everyone knows what we're talking about when we say war on drugs. And we are not talking about the fact that we want the war on drugs or that we support it, but it's a simpler way of explaining what is happening. There is a drug war going on. And for example, now, even with Trump, it is a reboot of the drug war. And I think it's just the way that the shorthand comes about, and we use those terms. I mean, it has been questioned, and we have sometimes talked internally about whether we should use it or not. But yeah, I think we've kind of come full circle with it now, and we do still use it. But it's a good question. I mean, it doesn't make sense. How can you have a war on drugs? I mean, the war is not a war on drugs, it's a war on people. And we also do say that, this is what it really means. When we're talking about a war on drugs, you're actually talking about a war on people all over the world, vulnerable people, people who use drugs, people who are marginalized. That's what happens.
I feel like you should just be like the invented war on drugs.
Yeah,
This was
please help us.
invented. Yeah.
Please help us. Yeah, the invented war on drugs. I mean,
Yes.
there's so many. I mean, there's so much, honestly, like terminology or slogans when it comes to this. I mean, this will probably blow your mind, but in 1998, there was a UN General Assembly special session on drugs. There have been several, but that was like the second one. And the official UN slogan for that meeting, the official slogan, they even made a UN poster, was "A drug-free world, we can do it." Yeah.
Who wrote that?
I mean, some brilliant guy, Kofi Annan, said it, I mean, the UN Secretary General was behind this. And actually in the political documents, the agreed documents, the negotiated documents, to this day, they still have, we affirm a society free of drug abuse. That's like the diplomatic language for we want a drug-free world.
Right.
And there are regional bodies that want, like, it used to be like a drug-free ASEAN by 2020, or they have these like a drug-free region by this date. And there are countries that are like, we commit to becoming drug-free. And how do we do that? I mean, through serious repression and violation of human rights.
No, I understand why that's problematic in so many ways. I mean, like that kind of brings me to drug policy in Canada. I mean, like I know that you've probably studied it, but right here where we are currently in British Columbia, we're having a bit of a crisis when it comes to drug deaths. I'll read it because I don't have it memorized, but the leading cause of death for people aged 10 to 59 in the province is drugs, and it's been declared a public health emergency. And I guess like this is coinciding with also British Columbia being one of the leading provinces, or I guess maybe even just like case studies in the world where we have clean needle sites and there's a lot of drug reform that has been happening within our province. What do you have to say about what is happening currently in Canada with drug policy?
Thank you for asking about it, and and I know you're sitting right there too. And I mean, there's so many things to say. North America is like the front line in so many ways of the failure of prohibition, right? Like the failure to ensure that there's a safe and regulated drug supply has resulted in all of these deaths from overdose, which were all preventable. It is devastating. I mean, it's devastating to see the numbers. And I know that some people are like, well, recently, you know, overdose deaths are falling slightly. They have fallen in the US, for example, over the last year, but still, they're still like up at, you know, I mean, at an unacceptable level. And, you know, Canada has been, yeah, I mean, heartbreaking actually in some cases, and BC and Vancouver particularly, because honestly, you know, 10 years ago, 15 years ago, because Vancouver had one of the first, what we call drug consumption rooms or safe injection sites, overdose prevention centers. There's many different, going back to the terminology of what was acceptable to policymakers who were like, who could argue with overdose prevention sites? Let's call them that, you know, because drug consumption room sounds problematic. But it was the first drug consumption room overdose prevention site, Insight in Vancouver. And, you know, that had obviously been such a huge problem with heroin use in Vancouver as well. So there was like needle and syringe exchange at scale, like harm reduction had been accepted, I think, by the local government. They had allowed Insight to open. So people were taken from all over the world to Vancouver for study visits for how to see like harm reduction in practice. Just because, you know, the idea of having an overdose prevention site where people can use drugs under supervision, and if they have an overdose, that can easily be reversed through a drug like called naloxone, especially when it comes to opiate use, was really groundbreaking. So it was seen as like, you know, really progressive. And then fentanyl hit the market in Canada and particularly in British Columbia, and that all changed, right? Then overdose deaths just went through the roof, and the services that were in place, you know, the really like full scale harm reduction services that are already in place just couldn't do anything in the face of this like unpredictable and toxic drug supply. People didn't know what they were injecting from one day to the next. The amount of fentanyl is very difficult to titrate. So it's very easy to overdose. It's, you know, 100 times more powerful than street heroin. So yeah, it's been devastating what has happened. And in the meantime, the discussion really has come back to, you know, you can have all these harm reduction services, but if the drug supply continues to be toxic and unregulated and unpredictable, if we don't solve that problem, we will not be able to prevent these overdose deaths. So we're back to the question of, you know, prohibition, who is it serving? And actually, what is the answer here? The answer here is to ensure safe supply. We've got to start there. People need to know what they're taking, what the right dose is. That is the first way to protect people in the current situation. And why is the market so unpredictable and toxic and unregulated? Because of prohibition, right? I mean, you know, I remember, you know, 3-4 years ago, I was invited by Health Canada to a meeting on reducing stigma. They had this as like the headline of the meeting in Ottawa because they felt like stigma is what's driving overdose deaths in Canada. Like it's young men using alone in their rooms because they're afraid, they don't want anyone to know that they're using, and they're overdosing alone and dying. So we need to reduce the stigma of drug use. And I was like, okay, that is an important goal. But I mean, if you're not going to remove the criminalization of people who use drugs, then you're still going to drive that stigma, right? I mean, it just like, they weren't really ready to talk about the criminalization element. But at this meeting, I met a police officer from BC, and he just blew my mind because we were talking about the situation of fentanyl in Canada and how devastating it was. And he was like, we wish that we could have just like the heroin market back. He was like, Canada's message to the rest of the world is keep your heroin supply flowing. Because once fentanyl came in, it's been so much more difficult to support people, to treat people who are dependent on fentanyl. And of course, the overdose risk is so much higher. And now the situation is that, you know, the market has shifted, and it's not, from what I understand, it's not even like there's not that much heroin around anymore. It is really just fentanyl and of course other synthetic opioids that are also quite strong, you know, in the opioid market. So there really has to be this very serious conversation now, because we didn't, like regulate the supply before. How do we regulate the supply now? And I know that there are efforts in Canada, by many colleagues in my network to bring forward ideas around safe supply. And I don't know, Amanda, if you've been following the case of the Drug User Liberation Front, who basically tried a couple of years ago and initially were given permission to operate, where they were buying drugs from the illegal market, testing them, checking them, and repackage them and redistributing them. But they're currently facing charges and a court case around what they did, even though what they did was an attempt to save lives and to address this problem of a toxic drug supply.
Right. So, I mean, like, this is this just is so heartbreaking because it's all happening all at once, right? Like, there's no like, we got to slow down and figure out what's going on, because it's just so insidious and rapid. Um, it's really astounding. So I guess, like, at this point, like, you're saying that the only real way is to test all these drugs somehow, right? Or to convince people that this is the way forward. Are most countries receptive to this? I think I know the answer to this. No, they're not.
No, I mean, going back to the international drug control system that I mentioned at the top of our call, there are three. I try not to get into it because it's like everyone's going to be like, it's very dull. But I mean, I think it's just important to know when you know about drug policy, because I do remember going to a conference in the US 2 years ago and meeting a young woman who actually worked for like a US government department on drugs, and she had no idea that there was an international drug control system, as in there are international legal instruments. There are three conventions, treaties, if you will, that basically denote how drugs are controlled by governments, and they have to follow those treaties. And I mean, it will come as no surprise to you that the US was the architect of those the treaty system, of course, and they have a very punitive thrust, and it is outside the scope, or it is a violation of the treaties, to allow the use of those substances that are under international control for any other use than medical or scientific. So, drugs like morphine are under international control, but we can use those in a medical setting. Governments have licenses to do that. That's allowed. But you can't allow drugs under international control, including cannabis, for example, for recreational use. That's a violation of the treaties. So Canada actually had a quite bumpy ride, for example, when Canada decided to make cannabis available for recreational use. And Canada accepted that this was a violation of the treaties at the international level. But I think what was interesting though was that Canada, advised by colleagues from civil society and international treaty scholars, made an argument to say we will be in respectful non-compliance with these treaties when we make cannabis available for recreational use, because we know that prohibiting cannabis is not serving our population. And that's how they went ahead and did it. But now, to your point around regulating the rest of the market, regulating allowing we call responsible regulation of other substances, would bring the Canadian government in contravention of international drug control law. And so that creates some challenges. We could argue that safe supply for people who are already dependent is a medical intervention, and we already have that in some countries, like in Switzerland or here in the Netherlands, where I'm sitting. There's heroin prescription programs, right? So for people who are really dependent, who tried an opiate agonist like methadone and it didn't work for them, they can apply to be on the heroin prescription program, and they can get their heroin on prescription. It's very forward looking, but this has been going on for 30 years in these European countries. So that is one way of providing that safe supply. But I think we would have to see it at scale in some countries. And there is also conversations around, what would cocaine regulation look like? What would MDMA regulation look like? There's probably different models of regulation for different types of substances because of their different effects on the body and their different levels of, what's the World Health Organization, the propensity for addictiveness. But, these are conversations that are happening. I mean, it's the cutting edge of where drug policy reform is. But yes, governments are extremely resistant. But we are increasingly saying, what are you going to do? What needs to change? Because everything that we've tried is not working, and more people continue to die, not deliberately, but from a toxic drug supply.
Right. And in this current climate, politically, it's almost as if like any kind of like different course of action will not be rewarded. It's like very delicate right now, I feel, where people don't want to make any kind of moves that might be out of bounds in fear of what might perspire, in the
Yeah.
geopolitical sense. Yeah.
Yeah, of course, and trying to be pragmatic about what's really going to save lives. And I think the medical argument for safe supply right now is one of the strongest ones, allowing people who are already in the situation of being dependent on these substances to find a way to, have access to the substance that they need without having to go to the illegal market.
But I mean, like optically, if you're to look at British Columbia as one of the first places to decriminalize and also have these safe injection sites, having an issue with deaths right now, which has to do with fentanyl, not necessarily with the policies that were put in place. I mean, like, are people turning away from this kind of movement forward towards something that is like a bit more humanistic, a little bit kinder to people that are addicted to drugs? Like, I mean, I'm just saying, like, it just like
Yeah.
appears like that, like optically, it doesn't look great because it's like we're having issues with it. It's not like working. I think some people would make that argument, which is disappointing.
Yeah, many people are. I mean, sorry, Amanda, if you're referring to like the decriminalization initiative that passed in BC, and then part of it was retracted, right, around public drug use. Yeah, I mean, we have been also on decriminalization policy. There has been what I would call a backlash, both in British Columbia and in Oregon. It was pretty bad, and it all happened around the same time. But, the thing is, like, what our detractors have managed to, I mean, first of all, I think both in BC and in Oregon, there was a lot of like media campaigning against the decriminalization initiative from the get-go, and a lot of misinformation that was put out there. The other thing is that decriminalization works, right? On its stated goals. The goal of decriminalization in British Columbia, as I understood it, going back to that meeting that I attended in Ottawa, because that was on the cusp of when it was going to happen, it was about reducing the interactions between people who are using drugs who are vulnerable and police, because the idea was that actually the police themselves were like, we think we're making this problem worse. We think that by interacting with vulnerable, unhoused, street-based drug users and like confiscating their drugs and arresting them or harassing them, we're actually like driving overdose deaths. And also they agreed not to do confiscations because they were like, actually, usually if someone who uses drugs has drugs on their person, they know where they scored those drugs from. They probably know the strength of those drugs. When I confiscate them, I'm sending them back to the illegal market. They might score off someone else. They won't know what the strength or purity of those drugs are. So I'm creating more harm. So let's have a policy of full decriminalization and we'll leave people alone. We thought that was great, but also, was it going to bring down overdose deaths? I mean, we weren't sure. I think that was the thing, but it was worth a try. The other thing was, but it was going to reduce police interactions with people who were vulnerable and marginalized, definitely. But at the same time, it wasn't going to reduce the situation of homelessness. It wasn't going to reduce poverty. It was never going to reduce those things. So I think that the fact that people still remained on the streets and still used on the streets in public spaces, that was an easy stick that our detractors could beat us with. Like, look, we've decriminalized and people are still using, and people are using everywhere and they're still on the street. And in Oregon, it was particularly bad because the decrim initiative that started in 2021 had hardly been in place when the moratorium on housing evictions was lifted. So suddenly there were a lot more people who were homeless on the street. and using just after the
Mm.
decrim bill had started to be implemented, and everyone blamed the decrim initiative and
Talk
didn't,
about bad timing. I cannot.
right?
Wow, I did not know that.
That's
Yikes.
exactly what happened, you know. So I think that's the other thing that we as a movement in drug policy reform have also understood, to be very clear about what it is that we're trying to solve when we're talking about decriminalization. We're wanting to reduce stigma. We're wanting to reduce the interactions of police and people who are vulnerable. You know, we want to reduce the number of arrests. You know, we just like that's what it does, but it doesn't solve all the problems of a toxic and unregulated drug market. You know, it doesn't go far enough. It's just dealing with one end of the market, which is the people who are using, right? The supply is still completely unregulated and not controlled at all. So that's where decriminalization has its limitations. I feel like we've gone down a really big drug policy rabbit hole, which I don't know if that's what you wanted to do. And the problem is I can talk about this too much, so I apologize.
No, not at all. I find it fascinating. Obviously, it's extremely devastating. And I'd say that the majority of the people that are listening to this are not well versed in what is happening or well educated about it. I don't feel educated about it at all. So thank you so much for the work that you do around it. I guess my next question would be, what would you recommend that people do in order to kind of stay afloat of this? I mean, like, I'd like to think that, like, the devastation of the communities here in Vancouver, it's really, really hard to grapple with. And I think it's left people feeling a bit hopeless, or just really unsure of what to do. And I think my generation specifically has a bit of paralysis. Millennials are getting up there. We're all getting into our 40s and our 50s and becoming kind of like the leaders, I suppose, of our societies in the wake of a lot of devastation. Not just drugs, like housing, financial crises, just everything. But when it comes to this kind of devastation around drugs, I'm just wondering if you have any advice for people on maybe how to stay informed, but also like maybe why it's important to be informed about it, even if it's not something that's happening within your like immediate communities. Although I think like I feel very close to it because like I drive I'm in the downtown east side all the time for a lot of the work that I do, and it's right in your face, but a lot of people don't see that day to day. What kind of advice might you have for, like, the everyday person that might not, I guess, be focused on drug policy as heavily as you are?
I mean, my general advice, I think, is to question the government's the narratives and all the things that I mean, everything that you've ever been told about drugs and drug policy. You know, to be honest, like question the conventional wisdom around it, and also remember that drugs have been an incredibly useful scapegoat, right, for governments to blame all the ills of society on that they rather would not address, like the problems of inequality, of poverty, of, lack of housing, the lack of employment. And then, I mean, drugs are not the cause. I mean, they're the symptom, right, of people finding a rational way through their situations. And I think it's important to not allow the dehumanization of people who use drugs by society and by government narratives to be what you just accept without question. There are broader structural issues at play here. And I think it's really about, asking more questions of your elected officials, like how did this happen? Why does this continue to happen? What shocks me in Canada and also in the US, for example, that is no elected politician has ever been called to task for the harms of prohibition. This is government policy in action that we have seen. These are choices that governments have made that have made the situation so much worse, right? And, no one has ever been called to task for that. And so that would be my first thing is, always question. Don't just accept what you've been told about people who use drugs, or about why they're in the situation that they're in, that they're bad, that they're disposable in some way. Like, that ideological moralizing is useful for governments as a tool of social control, ultimately, right? And this othering of other people who are, wrong and mad and bad and all the things. And then more specifically in Vancouver, I mean, the work of colleagues at the Canadian Drug Policy Coalition is critical. So know that there are people out there at CDPC, and, they coordinate a network who are working to, change the game, change the conversation. One of the oldest drug user organized groups in the world is based out of Vancouver. They're called Vandu, and their office is actually in downtown East Van. And they do amazing work. They've been doing amazing work on the front lines of this for, at least 2 decades. So you can familiarize yourself with the work of Vandu. Please, if you've never heard of the Drug User Liberation Front, look them up. I think they're, at the time of this recording, I know they're doing crowdfunding to support them as they go through the court case. But yeah, there's a lot of stuff happening in Canada, and there are lots of amazing advocates who are pushing back and challenging policy and working in community. So yeah, there's a lot going on. And I think if you reach out to any of those orgs, you can kind of enter into that like universe of what's happening if you did want to get more involved in some way, or be part of what's happening.
That's amazing. Yeah, these are really like concrete things that people and steps people can take to try to understand this more. From my perspective, I think a lot of it has to do with unlearning. Obviously, that's what you were saying, is unlearning a lot of what we've been told. But also like humanizing people who are addicted to drugs. Like, it's not people just call them drug addicts or crackheads or anything like that. And it's really such a, I don't know, I live in like a very suburban neighborhood here in Vancouver, and the Facebook group is just a bound of people that have no understanding or education around how people get addicted to drugs and the systems that they come out of, or that they live in. And it's very much like a individual, like they're the problem, like they're the enemy. And it's very sad, because I think they don't understand that a lot of people become addicted to drugs that are just like normal people. They're not just like born
Yeah.
like this.
Yeah.
It's wild to me
Absolutely.
that people don't think about it as like a human issue.
Yeah. Yeah. And also, I think there's another layer there too around, like, the more social capital you have, the stronger, the safety net around you, whether that's an economic safety net, for example, the less likely your drug use, even if it spirals out of control, is going to land you on the street, right? But if you're already like, marginalized, vulnerable, living in a situation of precarity, or you have some severe trauma, mental health issues, and your drug use spirals out of control, there's no safety net for you. And I think that's something else to understand, how the consequences are different for people at different levels of society, based on class and based on financial means.
You talked a little bit about this earlier, and but what do you do in your personal life to deal with like this very heavy work? The landscape of the world right now is quite heavy, I'd say. But you work really like kind of in the trenches of something that is incredibly devastating and heavy. What do you do like in your personal life? Do you feel like that helps maybe alleviate some of the pressures of that?
Yeah, I mean, it is quite heavy stuff that you're dealing with every day. It's true. I mean, I guess, on one hand, just to say that I feel like I work on policy, and sometimes that's very far removed from the reality on the ground. And that is also important to stay grounded in the fact that it's real people's lives that we're talking about, especially, a lot of my work is at the UN itself. It just feels like it's this, abstraction in a way that is so far divorced from the reality of people's lives. But yeah, in terms of what do I do, I mean, I think I try and maintain a strong work-life balance. I really try to sort of make sure that I leave my work. I work from home now at this desk where I'm talking to you, but I leave my work here, and then when I go down to my living room, I don't tend to work down there. So it's really just trying to find that separation, trying to make sure that I get outside, take the fresh air. I think there's so important to just like be in nature. I think like this idea of like forest bathing is really important, just being around green and breathing in the fresh air. And I mean, I do things like yoga and meditation. Of course, it all sounds a bit cheesy, but I do find that's important for grounding myself. So I love to cook. I think at the time of Loaded Bow, I was knitting. Yeah, and spending time with my family, and being in community with my friends. And I have a very active social life. And I really enjoy, being in the company of others and going out dancing and having fun, and, and having dinner parties where I can just cook like, for lots of people, and I can enjoy them. I think maybe that's something I want to share, is like, I really, really enjoy watching people eat things that I've made.
You like making people laugh and you like feeding people. We have this in
Yeah,
common.
and I think it's also because of this work, Amanda, because like the work that I do is policy work. We're trying to tear down a wall of prohibition that is like sometimes honestly insurmountable. I do think we're making progress, and part of it is like, changing the
Yeah.
mind of one person at a time. But at the end of my day, sometimes I'm like, what the do I have to show for today, actually?
Right. Right.
But I can invite my friends over and like cook them something or bake a cake and like watch people eat it, and that's tangible, because this work is long. It's a it's a generational agenda, right? It's going to take
Yeah.
years. It's taking
I think
years,
so.
but
I think someone at Loaded Bow called it available joy, like basically reaching
yes,
for anything that is like actually available, like, looking a little bit longer at a beautiful flower, or trying to just find little moments throughout the day to just
yeah.
sort of be in that moment and be
I
present.
say that a lot. I talk about available joy since Loaded Bow a lot.
Hmm.
Like
Yeah.
my morning cup of coffee, or like that text from, your best friend, or
Yeah.
there was 2 hours of sunshine today, like I told you. That was like, yay. Yeah.
Yay. Yeah, thank you
Yeah.
so much for sharing that. I mean, like it is such a dark time for many people, and it's hard to want to keep going. I just really do not want people to fall into despair when it comes to making change and trying to make our lives better. And it's really, like I said before, a lot to do with like individual growth. So I've been doing a lot of art because I just feel like being creative is just so healing. Doing bad art, just doing art, just anything, just do it. It feels cathartic. I know it's not for everybody, but just finding that thing that does feel maybe far away from all of this.
Yeah, exactly. And we do need that, and I love that you're doing art. I've been thinking about it myself too. I'm like, maybe I need to start doing some more coloring, or, I've got friends who like love their coloring in books. Yeah. I mean, I actually also do, I moved away from knitting, partly because I got tennis elbow from knitting. I know that sounds hilarious. How
Wow,
does
so
one get
hardcore.
tennis elbow? But
Very hardcore.
I do a lot of macrame. I don't know if that's how you say it in Canada.
Yeah, that's right.
And I really enjoy, I tend to do it more in the summers, but I really enjoy working with that kind of the fabric, the threads. There's something just tactile about doing something like that. And again, having a product at the end of it, this fruits of my labor that I can show, like, I made this and you can touch it and I can give
You're
it
like
to
it
you.
you're like, "It took me, 80 hours, but it's here."
It's here, exactly.
It's a coaster.
Um,
You really good
yeah, it's a
point.
coaster. Yeah, it's like my owl wall hanging. I could show it to you, but I think there's something for me about the tangibleness of something, but also working with
Mm,
threads. I really like that. I want to take up crochet. Still don't know how to do it, but that's on my agenda. But
nice.
to something you just said that reminded me, I think there's this quote by the abolitionist Mariam Kaba, you know, around how hope is a discipline. And that's also something that I think is important for us in this moment where the world is so dark and, the news is often just like, one horrifying tidal wave after another. And she talks about how the idea of hope is not like some fluffy, warm feeling that just comes naturally to us, but it's actually like a deliberate, intentional feeling that we need to cultivate in ourselves to know that, we need to keep putting one foot in front of the other. We need to keep fighting and take rest when we need to, but ultimately, keep up the fight for what we believe is right and have a discipline around that feeling of hopefulness of a better world, that change is possible. And that stays with me quite a lot, the idea that hope is a discipline. And actually, I know sort of I don't know, it makes me feel inspired to kind of carry on, even though it feels, sometimes hopeless.
Yeah, no, I totally resonate with that. I guess like people have like a tendency to feel like if they're not being productive like out in public or, maybe like you pushing like reform forward, anything like that, it's like not worthy. But I have to say like there is no fight for or no hope if people aren't good with themselves, right? So like for me, like it's an act of resistance to rest. It's an act of resistance to do bad art. It's an act of resistance to make a nice meal and to enjoy yourself. Joy is resistance.
Yes, absolutely. Yeah, I love that. And it's very true, especially in this moment, you know, finding ways to be joyful and to cultivate joy because they're trying to tear us down, they're trying to take away all of our joy and
Right.
make us feel hopeless. And therefore feeling that hope is also an act of resistance in this moment. Yeah, it's very, very
Absolutely.
true.
Thank you so much, Anne, for coming today, taking the time to explain and fill us in on everything that you're doing. Such important work that you're doing, and you're just a delight to talk to. Thank you so much.
Oh, no, thank you. It's been really lovely. Thank you for having me. And next time, I would love to do this in person with you in Vancouver.
Yeah, or I'll come to Amsterdam. Like,
You're very
um,
welcome.
I'm inviting
Anytime.
myself. Inviting myself. Okay. Thanks so much.
Thank you.
All right. Thanks so much. Stay bad.